Alzheimer's continues to be a growing concern as well. It's mentioned on your website, I know.
Yeah.
Can that possibly be tied to a nutritional disorder as well?
Well, it can. We know some of the factors that tend to promote Alzheimer's, and there are things that people can do to protect themselves against Alzheimer's. We know, for example, it's a condition of oxidative stress. There's been a lot of research on the protectors in the brain that stop working. And some of these are called glutathione, but maybe the most important one is a protein called metallothionein. And that's less than 1/3 normal in people who die of Alzheimer's compared to older people who die of something else. And that is an extraordinary powerful protector, both in the blood-brain barrier that keeps toxics and other things from getting into the brain, but also at overcoming oxidative stress and free radicals in the brain. And so we've developed a metallothionein promotion therapy, which so far we've only given to 130 people diagnosed with Alzheimer's, but the early results are really exciting. And we find that most of them get a partial improvement of memory, and then they stabilize for years. But we need to do some double-blind controlled studies to make sure it really works. Other conditions that we work directly with are schizophrenia and bipolar disorder. I've seen more than 3,600 schizophrenics, and they also are, schizophrenia is another name that given to completely different conditions. And there are 3 major types of schizophrenia that need completely different directed treatment, even though mainstream medicine regards them as all sort of similar and use atypical antipsychotics as the main way to treat them. But they'd be far better off if they could identify which type of schizophrenia they're dealing with. And another group that we've worked with is autism. I think my group and I have seen more autistics than anybody in the world. We've worked with clinically 6,500 cases. I'm certain we have the world's greatest chemical database for autism, and I think we're getting very close to understanding what autism is and how to help these kids.